Okay, the name of my topic is Anemia of Chronic Disease. My name is Dana Fields. The definition of anemia of chronic disease, it's also known as chronic inflammation. Um, it's a multifactorial anemia that is characteristically normochromic, normocytic, and hyperproliferative and associated with a mild to moderate decline in serum hemoglobin. Um, Let me explain multifactorial. It means that it can be caused by a number of things. Erythropoiesis is one of them, which is impaired. It's impaired either by a decrease in erythropoietin production and bone marrow response to erythropoietin, disruption in intracellular iron metabolism, and slightly shortened lifespan of red blood cells. It's also caused by the patient developing a disturbance in iron homeostasis. And it's also affected by the release of pro-inflammatory cytokines, which is stimulated by the chronic infection, inflammation, or malignancy. People at risk for the diagnosis. Anemia of chronic disease is an anemia that is found in people with certain long-term chronic medical conditions that involve inflammation. Anyone of any age with a chronic inflammatory infectious disease may be at risk for anemia of chronic disease, but the elderly are among the highest at risk. Um, some examples of these conditions could be autoimmune disorders like Crohn's disease, lupus, rheumatoid arthritis, or ulcerative colitis. Obviously, it could be cancer, or including lymphoma and Hodgkin's disease, or long-term infections such as bacterial endocarditis, osteomyelitis, HIV/AIDS, hepatitis B, or hepatitis C. Three key questions that you must ask the patients when you're trying to diagnose this condition is to inquire about the onset and duration of symptoms that may include dyspnea, decreased functional performance, and angina. Part of the reasons that you ask that question is because those are kind of key symptoms of anemia. So those are kind of some signs that they may be exhibiting. Um, Even though I have to say that anemia of chronic disease is usually pretty. It's a lot of times people are asymptomatic. But another question you can ask is there a pre-existing medical condition that may contribute to anemia, or or you can inquire about all their medications and to include over-the-counter medications because the patient may already have some pre-existing a pre-existing condition. Even something like diabetes may be one pre-existing condition that's important to know about, and it also kind of uh, stops you from having to try to figure out what is causing the anemia. And of course, we need to inquire about all medications because there are some medications that can kind of give some symptoms of anemia. The third question is there a history of anemia or evidence of bleeding, such as tarry stools, blood in urine, vomiting blood, or coughing blood? If that were the case, then that would be a good explanation for the anemia. So we wouldn't have to, it would kind of eliminate anemia of chronic disease possibly as a possible cause of a patient's anemia. In the physical exam, this is a very, um, it's atypical in that it a guided history is extremely important because it's usually the anemia is usually caused by numerous disease processes. Um, Therefore, the physical exam will likely reveal only findings that are associated with the underlying disorder, which could be inflammation, cancer, or infection, as I mentioned earlier. Um, to diagnose anemia of chronic disease, it's imperative that the diagnostic testing is done so that you can kind of be able to determine whether this is anemia of chronic disease. And some of the tests that would be important in diagnosing this would be, of course, a red blood cell count, hemoglobin level, serum iron level, serum ferritin level, serum transferrin receptor level, transferrin iron binding capacity, and total iron binding capacity. Common treatments. The condition is rarely severe enough to need a blood transfusion. As a matter of fact, sometimes it's self-limiting in that if you treat the underlying cause of the disease, then that will usually help to improve or even eliminate the anemia of chronic disease. Iron supplements and vitamins are generally not effective at all. Um, Another treatment in extreme cases is to give erythropoiesis stimulating agents. They can help stimulate the growth of new red blood cells. Examples of the ESAs include epoetin and darbepoetin. These drugs do have risks that are important to consider before using them, though. They can be pretty dangerous. Priority teaching would be mainly it's important if someone knows that they have a chronic condition, since the treatment of the underlying disease usually improves or resolves the ACD. Continuing prescribed treatment of the chronic medical condition and maintaining regular visits with your doctor are very important. That usually will treat the condition. I mean, it's important for them to know. And then also, if the condition is severe enough to warrant the use of ESAs, to stimulate the production of red blood cells, it's important to know that there is some evidence that ESAs may shorten survival in cancer patients. So if this is an option you choose for someone who has a malignancy, that's important information for them to know. And then, of course, red cell transfusions are effective, but should be limited to cases where other medical conditions which impairs oxygen transport, and when the patient's quality of life is very limited. So, I mean, just in extreme cases, would you do a transfusion? And that ends my presentation. These are the references. Thank you.